Thanks for joining in for today's webinar. The Johnson Center hosts free webinars throughout the year, and the next one will be on June 25th when Kelly Barnhill will discuss the importance of prenatal nutrition. You can see the full list of upcoming free webinars by going to www.johnson-center.org, then clicking on the webinars link on the right-hand side. You can also sign up for our email list there and stay up to date on all events and opportunities by clicking on the Join Our Email List link on the homepage. We currently have some terrific programs to provide support and assistance for children and families, including grants and sliding fee scales for diagnostic services, counseling support, sibling camps, and more. If you'd like more information, please contact us at info@johnson-center.org. We still have a couple spaces available in this summer's sibling camps for siblings ages 10 to 13, and scholarships are available. Be sure to follow our colleagues at the Autism Research Institute, as they also host several great webinars and share some great resources on their website and social media pages. If you would like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get your certificate. If you have questions during the live webinar, please type them into your GoToWebinar control panel or email info@johnson-center.org. If you are watching a recording of this webinar, you may email questions to the presenter at info@johnson-center.org. And be sure to check out our library of past webinars on our YouTube channel at www.youtube.com/The Johnson Center. Today's webinar is presented by Dr. Rundle. Dr. Rundle is a licensed clinical psychologist here at the Johnson Center. After completing her doctoral work at California School of Professional Psychology in San Diego, she moved to Austin in order to continue to provide psychological services in her home state. She's trained in psychological and neuropsychological assessments, and she also has years of training providing individual and group therapy for adults and adolescents, providing play therapy for children, and in facilitating social skills groups for children with neurodevelopmental disorders. Please welcome Dr. Jana Rundle.
Thanks, Morgan, for that introduction. So today we're going to be doing a Q&A on assessments. So when we use the term assessments, it basically includes any kind of psychological evaluation, so we use the term assessment, we use the term psychological evaluation or just evaluation. We also use the term reports, and they all refer to the same thing. Basically, there are psych tests that psychologists do and reports that they write about a clinical question. So the question could be, does my child have autism? So that would be the clinical question for a psychological evaluation or an assessment, and then the psychologist would do testing to answer that question and then write up a report with their clinical observations and their diagnoses and recommendations. So I use those terms interchangeably, both testing, assessment, evaluation, report. They're all referring to the same thing. It's basically psychological tests that psychologists give. Like if I were talking to a colleague, like another psychologist, I would probably say, I do testing full time, and they would know what I'm talking about. If I was talking to someone who's not a psychologist, I might say that I do psychological evaluations, but they're all referring to the same thing, and we use them interchangeably all the time. So just want to tell you that because I'll be using all the terms, and they are all referring to the same thing. So don't think that like assessment is different than testing and report is different than assessment. They're all the same. I mean, sometimes if you're talking about a specific test, you might call it assessment, and then you might call an evaluation like the broader group of tests, but we really use them interchangeably and they all mean the same thing. So just a little disclaimer, I did get questions ahead of time, so I did have time to put them in slides. So we'll be going through the questions that I got emailed to me first, and I had time to put those on slides. And then if you have questions as we're going through, be sure to write them in your chat box, and one of my colleagues will be handing me questions live throughout this webinar. So if you feel like, well, I didn't have time to write a question, don't worry, you can write it now and I'll try to get to it at the end, but these are questions that I got in advance, so I was able to put them on the PowerPoint presentation. Okay, So first question, who can provide a diagnosis of autism spectrum disorder? So there's a lot of different clinicians and providers who can provide a diagnosis, including psychologists. I'm a licensed clinical psychologist, a psychiatrist. So a psychiatrist is a medical doctor. So psychiatrists go to medical school and then they specialize in psychiatry. And basically psychiatry is treating psychiatric problems with medicine. So psychiatrists or medical doctors, sometimes they do therapy, but most of the time they're prescribing medication. So psychiatrists can provide a diagnosis, pediatricians, and neurologists. So all of those providers could give a diagnosis of autism spectrum disorder. Of course, the way that the diagnosis is given, the type of information that's gathered, the type of questions that are asked, the amount of time that is spent with the child, all of those will kind of vary depending on what type of provider that you're seeing. When we're talking about psychological evaluations and assessments and testing, that tends to be something that psychologists really only do. That's just kind of one of our niches, I guess you could say, for psychologists. There's a lot of people that can provide therapy, lots of master's level clinicians that can provide therapy, but one of the kind of bread and butter things that psychologists do is psych testing and evaluations. So if you're talking about wanting your child to be diagnosed with some real test data and a real report, a psychologist is probably going to be your best bet. Although technically a neurologist and a pediatrician could probably train to do testing too, but they tend to focus on other things. So those are the types of providers that could possibly give you or your child a diagnosis of autism spectrum disorder. All right, next question. Why do I need an assessment? Isn't my diagnosis from my pediatrician, my primary care provider, my neurologist enough? I mean, that's a difficult question to ask because I guess it depends on what you're looking for, right? So just like I said in the previous slide, the type of information that you're going to get from providers is going to differ because the training is different. The treatment kind of rationale for treatment is different depending on which provider you're going to see. When you're talking about getting a diagnosis from a medical provider, they're probably going to focus more on medication that can help treat symptoms. Whether if you're getting a diagnosis from like an autism specialty clinic like the Johnson Center, we're going to be looking more broadly at how we can help with our multidisciplinary team, our different clinicians in different areas. You know, we have nutrition, we have the medical doctor, we have the psychologist, we have the behaviorist, we have all the things. So it just depends on what you're really looking for. Assessments are great because they provide objective information, they provide data, and data is so important when you're talking about autism because when we think about autism as a neurodevelopmental disorder, that means that it changes the way the brain is organized for kids. So with that change in organization of neurodevelopment comes strengths and weaknesses. And what we want to do is track those strengths and weaknesses. We want to see how that child is functioning, how that child compares to their peers, where their strengths are, where their weaknesses are. We want to be able to tailor treatment to address those particular strengths and weaknesses. What is so interesting about autism, or what I think is so interesting about autism, is that it is a spectrum, right? So we have just this really wide area of skills and strengths and deficits, and each child that walks in our door, each child that we see is unique, and they have their own set of strengths and weaknesses that we need to tailor treatment around. What I find kind of a bummer in other kind of cookie cutter autism treatment facilities is that they kind of have like a cookie cutter way of treating autism, and they treat everyone the same. And sometimes that doesn't work very well because everybody is so different. So why an assessment would be important, why you need an assessment, is that it really provides unique information about your specific child and how your child is doing. And then the data then can be compared to data later on the road. So especially when we're talking about really young kids and diagnosing young, assessment can provide such crucial information about baseline level of functioning. So if we can diagnose a child at 18 months, at 2 years, at 3 years, we have a baseline, like, okay, here's how they were doing at 3. Let's test later at 5 and see what gains they've made. This can be really important because when you're talking about autism treatment, this is expensive, this is time consuming, it is your hard earned money going to treat these deficits and to help promote skill building, and you want to be able to track it. So that's why, one of the reasons why it's so important to invest in a good assessment, because it helps create knowledge for you of how to make decisions. So important that we make informed decisions, and a good assessment really can provide you with that information that you need to make a good informed decision. Another good reason is that as we've kind of gone into insurance paying for autism treatment, a lot of these insurance companies want to see a good assessment, want to see scores, actual scores that they can put into their system. I don't know what they're doing. I don't work for an insurance company, but I do know that very often they require an assessment and they require certain test scores. So that can be really important if you're trying to think about getting reimbursed for some of this treatment with your insurance company. Having an assessment can be really valuable because they're going to require it eventually. So you might as well have it so that you can get treatment started. Another great thing about assessments, if you're talking about a good assessments, and I shouldn't have to say this, but I will say this just so you'll know, not all assessments are created equal. They're not all evaluations, and evaluators, unfortunately, are going to be great. So it's so important to find a good, someone who's trained in autism. Obviously, the autism specialty clinics are going to, for the most part, provide specialized care and a good knowledge of autism and how it manifests throughout the age spectrum, the age range, developmental spectrum. But yeah, not all providers. You could go to a private psychologist and pay for an assessment, but what if that psychologist isn't really trained in autism? So it's important to find someone who's really trained in whatever your clinical question is, whether it's you want information about ADHD, you want information about autism, you want information about learning disabilities, you want information about your kid's emotional functioning. You need to go to someone who really knows how to test for those things and then interpret their results and then write a good report. So that's really important. But one of the great things about having a good report is, so reports are divided into different sections, right? So if you see a report, usually they have the same template. And I don't know who created this template, but we basically all write our reports the same way. So we'll have like a little blurb about their demographic information, background information, all the history. Then you'll go into your scores. Then you'll go into your summary and your diagnosis. And then the last section is the recommendation section. It's usually at the end of the report. And in general, if you're seeing someone who knows what they're doing, it'll be really thorough and provide you with really specific things of what to do and what recommendations that provider is suggesting that you do to help treat the specific things that came out of the assessment. So for instance, our recommendations on a typical report might be like 2 to 3 pages long. I mean, we're talking about 14, 15 different recommendations of different specific things that we think this person, this family should be doing to help promote the well-being of their child. So assessments are kind of unique that way, where you get objective data, you get actual scores that the psychologist should, in theory, explain to you, and then recommendations of here are the steps that I would take. So that's something that you're likely not going to get unless you're getting a psychological evaluation. Another important thing that is so fun when if I'm doing an assessment and then I see that they've had a previous assessment, I get to go through that previous assessment and look at the scores. It's even more fun if I did the previous assessment, but I get to look at the scores and then see the new scores and then get to compare the scores. And that is fascinating because then we get to say, okay, well, 2 years ago, the scores were X, Y, and Z. And now look, they've changed, and how they've changed. And the psychologist can help tell you why they think they've changed, or what things we need to be doing to promote more change. So it really provides kind of a blueprint for treatment and for adjusting treatment, for modifying treatment. It really helps track changes in treatment efficacy. And when we're thinking about autism, our kiddos usually need quite a bit of intensive treatment. So this is so important to be able to have the data to look at the treatment goals and then make changes according to what the data says. So that's just my spiel on why do we need assessments in our lives. All right, next question. What tests should be included in an autism assessment? So I'm going to give kind of broad general overviews, but when we're thinking about assessments, obviously every person is different. And I'm giving you kind of general ideas, but obviously we're going to take it's a case-by-case scenario. And when people come in, we tailor a treatment program for them. We don't just have kind of oh, here's what it includes. We have kind of an idea of what it includes, but every person that comes in and wants an assessment, we do like an initial kind of, what question are you trying to answer? And then that information comes to me, and I think about what tests would be required to answer that question. We call it a clinical question. So it's kind of our rationale for testing. Why are they coming in for testing? A lot of the times for us, it's, does my child have autism? A lot of the times that is the clinical question. So when I'm thinking about an autism evaluation to determine, does this child have autism or not, this is kind of my backbone. This is kind of what I'm always thinking about, are autism specific tests, and there are quite a few out there. The ones that we rely on here are considered the gold standard test for autism. It's the Autism Diagnostic Observation Schedule Revised, ADI, second edition, there we go. All these tests have different editions and they're updated every year, so I get confused. The Autism ADOS second edition, that is what we use, and then also the Autism Diagnostic Interview Revised, the ADIR. So those are the two gold standard tests that we use. They are not, what should I say? So they are difficult to administer and score. They take a lot of time. So they aren't commonly used in the school districts. If you're not going to an autism specialty clinic, somewhere that really focuses on autism, it may be hard to find someone who's really trained to give these tests, but they are the best. They are super thorough. That's why they take forever. And they're really good at detecting, neurodevelopmental disorders have a lot of overlap. There's a lot of symptoms overlap with attention deficit disorder and autism spectrum disorder. So we have to differentiate what's what. What am I looking at? And a really great way to do that is to use the combination of the ADOS and the ADIR. They were developed to be used conjointly, so we use them conjointly. We use both. They are very thorough. They have really good validity and reliability. So that's what we tend to use. If you go to an outside psychologist, they might use kind of shorter screener tests. Those are also great too. I've been known to use those, but we tend to rely on our ADOS and our ADIR and use the screeners just conjointly. Or if someone, was being retested, we already have the ADOS and ADIR. Actually, I very rarely use screeners. I really just use the ADOS and the ADIR, but if you were going to a private psychologist, they might use the screeners, and that would be an important thing to know, is what types of tests are you going to give them? What are the names of the test? Are you going to be doing an ADOS? Are you going to be doing the gold standard test? Or are you going to be doing the shorter, more screener versions of the test? So autism tests, obviously very important. Also, a cognitive test is usually included in a assessment battery. I got several questions about cognitive tests, so we'll go a little bit more in depth about cognitive tests and why I think they're important. And then also an adaptive behavior scale. So that's kind of when I'm thinking about our autism diagnostic battery, these are the tests that I'm almost always giving in our diagnostic battery. So usually some autism tests, especially if the clinical question is, does my child have autism, a cognitive test, and an adaptive behavior scale. So those are kind of our core group. And adaptive behavior scales are kind of divided into different sections. So an adaptive behavior scale that we use is called the Vineland. It tests expressive language, which would be your ability to express yourself, receptive language, which would be your ability to understand verbal directions, verbally inputted information, motor skills, social skills, self-help skills. So like, can they brush their teeth? Can they make a snack? So it assesses all those kinds of things. So that would be what I would be looking for if I wanted my child to be test for autism. I would be asking the provider, what tests are you giving? What are the names of them? Do a quick Google search. They're probably good tests if you're seeing someone who's reputable and who knows what they're doing. But it would be a good question to ask, you know, what type of cognitive test are you giving? What type of test for autism are you giving? The adaptive behavior scales, there's quite a few good ones, so I would be less worried about that. But the autism specific tests, for sure, I'd want to know if they're giving an ADOS and an ADIR, or if they're just giving really short screeners. Other tests that are common that we use, and you know, really, if you're thinking about psych testing, there is a test for everything. There are thousands of psych tests in the world that test for everything. That test for psychopathy. So like there's tests for sociopaths, and there's all kinds of tests. That's information for another webinar, but just so y'all know, there's tests for every clinical question. So even if you're not so interested in autism, but you think your child may have ADHD or a learning disability, there are tests for all of that. So there's achievement tests, which would be like school-based assessments, you know, is your kid at grade level or not? There's neuropsychological tests, which would test for memory, executive functioning, which executive functioning is what we use our frontal lobe for, so the lobe in the front of our brain. It helps us with planning, impulse control, organization, tracking, so like tracking information, and also attention. So there's tests for attention. There's skills-based assessments. So can my child do this? How does it compare to other kiddos, the child's same age? There's sensory profiles that look at sensory information. There's personality tests, which can look for, you know, personality structure, how the child views other people, themselves, the world, what kinds of mental health kind of symptoms are they having, depression, anxiety. There's motor visual tests. I mean, there's just tests for everything. So really any clinical question can be answered with a test, and tests are great, like I said before, because it provides you with data, and data, we're a data-driven world here. And we need the data to make good decisions. Okay. Next question. Oh, like I said, I got several questions about this, so I definitely want to hit on this. Do we need to assess for cognitive functioning? So I would say, obviously, it depends on the person, and we take everybody as unique, but in short, yes, we need to test for cognitive functioning. So any psychological evaluation should be really hinged on a cognitive test. So when you go get tested for anything out in the community with a private psychologist, there should be a cognitive test on that psychological evaluation. And it's really the backbone of our psych evals. So even if you were going in for, you know, anxiety and you wanted testing, that test would probably still include an IQ test, because cognitive functioning is just, it's just kind of standard of care. We always give an IQ test. So when I'm talking about cognitive tests, those are IQ tests. So it would be a test that tests your abilities, your cognitive abilities, and then shoots you out an IQ score. So IQ scores, I think, are important for autism evaluations because the scores help me with my diagnostic clarification. Obviously, the autism specialty tests, the ADOS and the ADIR, are really going to provide me a lot of information about autism specific symptoms, but autism is so varied, and there are people that come in with some symptoms of autism and some symptoms that look nothing like autism, and the IQ scores can really help me parcel out, what am I looking at here? It can help with either providing a rationale for a diagnosis or a rationale for not giving a diagnosis. So the IQ scores, to me, provide really helpful information for diagnostic clarification. It also is important when we're thinking about autism to either rule out or confirm an intellectual disability. So intellectual disability is common in our autism population. The most recent numbers from the CDC estimate that 38% of individuals on the spectrum also have a co-occurring intellectual disability. So it's really important to get those cognitive scores to find out, where is your child functioning when we're talking about IQ. That's going to help determine treatment plans and help revise treatment goals, and it just provides you a lot of information about cognitive strengths and weaknesses. When we're thinking about autism, it is super common for kiddos on the spectrum to have splinter skills, right? So to be really, really good in one area of cognitive function and to be pretty low in another area, and we call those splinter skills. So they may have, you know, be able to do every puzzle that you've ever put in front of them and do it fast and do it well, but may not have good verbal skills or whatever. But we want to be able to see those. We want to have information about what the cognitive strengths and weaknesses are, because your kid has them. We all have them. I am not so great at math. That's why I'm a psychologist. I didn't have to do a ton of math, although statistics, I guess, is math. But yeah, we want to know where our kids' strengths are. We want to know where the deficits are so that we can help promote learning and help promote skill building in those deficit areas. So it's really important to have cognitive scores. Where I maybe wouldn't do it is like if we're talking about a really young kid. There are tests of IQ for like really young children, and I laugh because, like, what does IQ look like in an 18-month-old or 2-year-old? I mean, we really don't know. I mean, we test skills, and there are tests for cognitive functioning in really young children, but I would say it doesn't really become super reliable and super stable until like 5 or 6 years old. So yes, I test 4-year-olds. I test, there is an IQ test called the WIPSI, the Wechsler Preschool Primary Scale of Intelligence. We call it the WIPSI. And I believe it starts at 4, and so I'll give kiddos the WIPSI, and it shoots me out an IQ score. Before that, like at 2 or 3, there are tests that we can give, but I would say it's not super reliable until 4, 5, 6. That's when we really want to start getting a solid IQ score to know what we're dealing with. Another thing that I think is interesting is IQ scores. So in theory, when you Google IQ scores, it's going to tell you that they're stable over time. And for neurotypical people, that is true, but we're not dealing with neurotypical people. We're dealing with autism, which is a neurodevelopmental disorder. So it is not, I would say that IQ scores in our population are not stable over time, especially when you're thinking about someone who might have some verbal deficits. If you give a kiddo on the spectrum an IQ test, it has a really heavy verbal load. The directions are given verbally. There's tests that specifically ask about verbal intelligence, so tests about vocabulary, tests about word knowledge. So if you're talking about a kid who has a verbal deficit, they're not going to do so well on those sections. They may struggle through the whole thing because of verbal deficits. With treatment, I've found that as this child becomes more verbal, you're going to see changes on those IQ scores. If you tested a kid who was limited verbal at 4 and then you retested him at 10 and he's like fully fluent, the scores are going to be drastically different. So the IQ scores can provide information about how the child is changing, how the child is excelling, how the child's strengths are becoming more seen in the scores. So, you know, I think it's important to have the information, and that's what assessments are. They're information. It's information that we need to make treatment decisions and revise treatment goals. So the only reason I wouldn't give an IQ test in my battery is if the kid was really, really young, like 18 months. But I would still give several other tests to assess developmental level and developmental functioning, or if the kid just had a test. So the tests that psychologists tend to use are called the Wechsler test. So the WIPC is one that I just mentioned. That's for younger kids. Then as we move into kind of elementary age, it changes to the WISC, which is the Wechsler Intelligence Scale for Children. And then as adults, we go to the WAIS, which is the Wechsler Adult Intelligence Scale. So if y'all are interested in IQ tests, I could definitely do a whole webinar on IQ tests. So if y'all are interested in that, definitely let us know. But there is a test for every age, and IQ test is, the IQ score is so important, but the only reason that I wouldn't give one is if the child just had a Wechsler test. So if a child comes in and has a school evaluation and they were just given a Wechsler test 4 months ago, I'm not going to repeat that test because there's something called practice effects. And that's when you repeat a test that was just given and the scores are not going to be accurate because they're going to remember the test that you just gave. And instead of testing their abilities, you're going to be testing like their innate abilities. You're going to be testing their ability to remember what they just did a couple months ago. So we don't tend to test if they've had a Wechsler test within the last year. I wouldn't give it again. If it was over a year ago, you'd probably be able to give it again. But within the year, we don't redo a test. So that's the only reason that maybe I wouldn't give one, is if they just had one and there's no reason to give one, or even if you did give one, the scores wouldn't be accurate. So I wouldn't. It would be like not a good idea, basically, to re-give it. But in theory, yeah, we, broadly speaking, and I don't want to speak to anyone's case specifically, right? But broadly speaking, we always want our psych evals to be accompanied with a cognitive test, an IQ test. Hopefully that answers that question, because there were quite a few about cognitive testing. All right, next question. I got so many good questions, so I appreciate all of the people who sent in questions. Okay, how often should I have my child reevaluated? I got this one in several different ways, but in theory, I think people were asking the same thing. So that's going to vary, right, based on the clinical question, based on the person's unique story. But in general, we want to evaluate progress pretty regularly. I know that's not helpful, pretty regularly. But we always want to be evaluating progress, especially if you're talking about someone who's getting pretty intensive treatment. You want to be evaluating that treatment. So several times a year, if you're talking about skill building and like ABA treatment, that ABA provider should be reevaluating progress like every few months, because they should be modifying the program, they should be updating the goals. When we're talking about a psych eval, like a formal psych eval, it can range between, I would say, anywhere between 1 to 3 years, just depending on the person, depending on the clinical question. But we do want to do reassessments because we want to see how those scores have changed over time. And we want to be able to compare scores to previous scores. And we want to be able to update treatment goals and update plans. So you want to make sure that you have, if you're spending all this money on autism treatment, you want to make sure that you have the objective data to make good decisions. And you know, a parent is the best advocate. So I know we have these treatment teams of providers and doctors and you know, support people, but you are going to be your child's best advocate. So the more informed that you can be about assessments and about tests, psych evals, and about scores, the better advocate that you can be for your child. I will say this, and I can only really speak on Texas public schools because we're located in Texas, but very often the public schools by law should be providing a reevaluation for the kiddos in special education every 3 years. Okay, so that is by law, and y'all can definitely Google and read up on your state's own laws, but that is how it works in Texas, that they should be reevaluated every 3 years. Very often, I've seen the schools kind of get around that by saying, oh, this child doesn't need a reassessment. So just know your state's rules and the laws so that you can always request. So they might say, oh, we don't need to do a cognitive evaluation. We already have scores from 6 years ago. You as a parent can say, actually, I would like the cognitive scores. And they should provide you, they should do it themselves, or they should pay for an outside psychologist to do it. It is their job to reevaluate your child, because as we know, these test scores will change, and we want to be able to see the growth, and we want to be able to see the deficits so that we can treat the deficits. So I would just say anywhere between 1 and 3 years. The school should be doing it every 3 years, but you have to be a good advocate and stay on them, because a lot of the times they'll try to get out of it. And I'm not being judgmental. I know that they're so busy and they have these caseloads that they can't keep up with, but it is the law. And if you know the law, they will do the reevaluation. So just keep up with it. So here's a little kind of, what do we call this? And I don't even know, a picture that I made, I guess, of why we want to do reevaluation. So we'll start at the top here, gathering data. So gathering data is going to be how we do our psych evals. We gather data, we ask the parent questions, we interview, we do behavioral observations, we gather all this information, we read medical records. That is the gathering data stage. Then we do the testing, and the testing provides us with answers. It provides us with a profile of skills. Then we come up with the treatment plan, the recommendations. That lets us measure change. It lets us revise the goals, and it should be a circle, right? So we should be doing this every few years, because we need to be measuring change, we need to be revising the goals, and we should be gathering the data and then doing it again. So hopefully that makes sense of why this needs to be like a revolving door of information, tests, scores, treatment goals, revision. Like, it should just be a cycle, because we're talking about things that change, skills change, behaviors change, and so we need to be always monitoring that. Hopefully that makes sense. All right, I got a lot of more questions, so I'm going to try to get through them. All right, how do I understand the scores? So this is complicated. I'm going to try to make it as simple as possible. So standardized tests, which are the tests that we use, I'm going to use IQ tests as an example. So if I give an IQ test, it's going to shoot me out standard scores. So standard scores are basically taking the raw scores, which would be how many points did they get on X tests. So it takes the raw scores, it uses their age. So if we're testing, let's say, a 10-year-old, we're testing a 10-year-old and they got 10 points on this is just an example, 10 points on this vocabulary test. We're going to take that information and we're going to convert that raw score into a standard score. And basically what a standard score does is it converts it using a statistical formula into a score that can then be compared to other kiddos, their age and their scores. Okay, so let's say a raw score of 10 on the vocabulary test. Let's do this, verbal. Okay, so we'll say a raw score of 10 on a verbal comprehension index of the WISC corresponds to a standard score of 100. So a standard score of 100 is average. So like I said on the slide, the mean of a standard score is always 100. So you know that if your child gets a standard score of 100, that's in the average range. And then a higher score would be above average and a lower score would be below average. So it basically, what that does is it allows us to compare Johnny's score on the verbal comprehension index to Susie's score on the verbal comprehension index because their raw scores will be converted to standard scores, and then we'll be able to compare them. So Johnny got a 100, but Susie got a 120. So she did quite a bit better than Johnny. So that's what a standard score is. It allows us to compare scores across people. T-scores are similar, they just have a mean of 50, but it's basically a converted score. So they take the raw information, they do a statistical formula so that you can then compare the score to other people who've taken that test. The only difference is a T-score has a mean of 50. And then there are scaled scores, which scaled scores would be like subtest scores. So when we're thinking about an IQ test, you're going to get your index scores, which are going to be kind of your broad scores. But there were 10 subtests that went into all those index scores, and those will have scaled scores, and those have a mean of 10. I know this is all very confusing. And there's a website that I put on the end of this Q&A that offers a lot more in-depth information if you have a report and you're trying to understand the scores. Your psychologist too should have provided you with an explanation of the scores, but I know not all psychologists do that very well, and I'm doing the best I can right now too. Okay, so here is a chart that kind of explains. So IQ scores fall on a bell curve, right? And when we think about bell curves, they are present everywhere. They're present in nature all the time. So if you think about height falls on a bell curve, with most of us falling in the average range. So the hump, you know, in the middle is the biggest, meaning the most people fall in the middle. Most people are average height, right? And then you have the outliers. You have the really, really, really tall people that are going to be over to the right side of this bell curve. And then you're going to have the really, really short people, also more rare, right? There's less really short people in the world, and they're going to be over to the left of the bell curve. IQ is the same, right? So most of us fall in the average range. Most of us fall in the middle. That's why the hump is bigger there. And then we have fewer people that are very, very smart that fall over to the right, and fewer people that are lower functioning that fall to the left. So you can see that the standard score of 100 falls right in the middle. If you can look down, the T-score of 50 is the same thing as a standard score of 100 and a scaled score of 10. They're all average, right? So if you got a standard score of 100 on an IQ test, that means you're right at average. You're right where you should be when you're comparing yourself to other people your age. If you got a standard score of 115, you're a bit above average. If you got a standard score of 130, you're very, very smart. You're doing really well. So hopefully that kind of explains, most of the time we're going to be giving standard scores. Some tests give T-scores, but more often than not, they're going to be standard scores with the mean of 100. So anything above 100 is going to be a little bit above average. Anything below 100 is going to be below average. And then without getting too much in the weeds, we also talk about standard deviation. So standard deviation, if you're looking at this bell curve, it's the weird little symbols that are right below, what is this, the x-axis, the horizontal axis. Those are standard deviations. So standard deviations is just a statistical term that tells you how much the scores vary from the mean, right? So if you have a mean of 100, how close together are all the scores to the mean? And that's what a standard deviation is. So when we're talking about standard deviations, if something was 2 standard deviations below the mean, that would tell me that it's pretty significantly below the mean, that that person didn't do so well on that test, if that makes sense. You don't really need to know about standard deviations, but standard scores and scaled scores you do need to know about, because if you get a psych report, it's going to have these scores on it, and it would be good to know what they mean. So hopefully that helps. If y'all have more questions about that, I can definitely do another webinar all about IQ scores and how to interpret them. But hopefully that's just kind of a broad overview of what the scores mean. All right, I got this question too. It's very good. How is learning disability diagnosed? So learning disability diagnosis can be diagnosed in different ways. But for me, I was trained to compare IQ scores to achievement scores. So we've been talking about IQ tests. IQ tests will send you out index scores, which kind of tells you how you do on broad areas, verbal, perceptual, memory, and then it shoots you out a full scale IQ score, which is kind of how all those things averaged out. I mean, it's not an average, but we'll just say it's an average. So it's kind of how did all of those areas that we tested average out, and it'll shoot you out one score, which is called the full scale IQ score. So we use that score generally, and then we compare it to achievement test scores. So achievement tests, I talked about briefly earlier, are school-based assessments. So they are very similar to school. It's going to be like spelling, math, and it's going to show you kind of where that kid is at grade. Is at grade level? Is he above grade level? Below grade level? And you're going to compare those scores. So when we're thinking about IQ, IQ is ability. IQ is what you're able to do. Achievement is what you've achieved. So sometimes they can be different. We can have a really, really smart kid who's not paying attention in school and therefore not learning, who's not achieving. So hopefully that makes sense. So IQ is ability. It is, the tests on an IQ test are not really like school at all. They're testing more ability, and then achievement tests are testing your achievement or where you are on school-based assessments. So when we're talking about learning disabilities, we want to see, if we're trying to diagnose a learning disability, we want to see a discrepancy between ability and achievement. So we're going to be comparing IQ scores with achievement test scores. So this is just an example to help demonstrate. So if I was doing tests and then I saw that this child had a full scale IQ of 100, which is average, like we said, that's the IQ scores are standard scores. So 100 is going to be smack dab in the middle. Very good. So we'd be pleased to see 100. And then if we looked at the achievement test scores and we see, okay, broad reading 105, right in the average range, perfect. Broad math 75, what's up with that? Because we should be expecting it to be somewhere in the average range given their ability, right? So we know that their ability is average, so we would expect their achievement to be also average. But for this example, I just made these up, is not average. 75 is over 1.5 standard deviations, so we know it's quite a bit lower than the mean, right? Because that's what standard deviations are. It's over 1.5 standard deviations below the mean. So 75, we know, not doing as well in math as we would expect, right? And that's what a learning disability is. It's a discrepancy between ability and achievement. So if I was seeing these scores, and obviously I would be taking into account a lot more information, grades in school, information from teachers, information from parents. So that is what an IQ score is. All right, hopefully that explains learning disabilities. Okay. Next question. What's the difference between an evaluation from a school psychologist and from a private psychologist? I get these questions. Okay. School psychologists are different than private psychologists. So school psychologists go to a school for school psychology specifically, meaning that they want to go practice psychology in a school. And school psychologists can be master's level clinicians or doctoral level clinicians. It just depends on what program they went to, but they are really only going to work in the school. Their training is treating, diagnosing in the school setting, whereas a private psychologist is going to be able to do, the training is just a lot more broad, right? Because psychologists can work in hospitals, in clinics, private practice, everywhere. Specialty autism clinics like the Johnson Center. So that is the main difference. As a school psychologist, it's just different training. So a school psychologist, they pretty much only work in the schools, whereas a private psychologist can work in a lot of different areas. Hopefully that answers that question. So this question I got, who can offer therapy for a child with autism? It can be depending on what type of therapy you're talking about. For behavior therapy, which would be like ABA, most often that is given by a board certified behavior analyst, a BCBA. So a BCBA would be kind of in charge of your child's behavior plan, treatment plan, all the goals, and they would be putting together a team of people to work with your child on reaching those goals. So if we're talking about ABA, most often that is done and handled and organized by a board certified behavior analyst, a BCBA. If we're talking about individual therapy, social skills training, parent support, that can be done by a lot of different types of clinicians. So that could be psychologist, licensed professional counselor, licensed marriage and family counselor, clinical social worker. So it just depends on what type of therapy you're talking about. We are doing another Q&A on therapy, specifically on July 11th. So I'll be doing that with our LPC BCBA. She's a dual credential, Amanda Tammy. So if you're interested in more therapy questions, definitely check that out on July 11th. I believe it's at noon. I think all of our webinars are at noon. So that'll be me and our LPC BCBA, Amanda, answering questions about therapy. Let's see. Okay, I did get a couple of different questions live here. Let me read them real quick. So this question is interesting. Can autism spectrum disorder and disruptive mood dysregulation disorder coexist? The school pushed back saying, according to DSM-5, they can't coexist, and that disruptive mood dysregulation disorder is not a comorbidity of ASD. That is interesting. They absolutely can totally coexist. I'm not sure what the school is saying there. Could be a miscommunication, or perhaps they're just saying they don't want to treat the disruptive mood dysregulation disorder. But you know, any and all disorders can coexist. Comorbidity can happen with anything. It's just like you can have cancer and a cold at the same time. All of these things can coexist. So that's an interesting question. I would definitely push back on the school on that or get more information. We'll be going to a new school. 9-year-old with ASD will have to be tested. What questions should I be asking the school psychologist, and what should I be looking for? This will be his first school testing. You definitely, I'm not sure how testing works in the school, if they're open to questions. I would want to know what types of tests they're giving. If a cognitive assessment is going to be included, I would ask for one. If it's not being included, I would definitely ask for one. I would ask what types of autism scales they're giving, if they're doing an ADOS or an ADIR, or if they're relying on the screeners. The screeners, I mean, they're not bad. Like, these are good tests. I would just be curious to know what they're using. I would want to know what they're going to do with the information, what kind of recommendations they're going to be trying to come up with. They should hopefully kind of sit down with you and explain the process. If not, I would definitely ask for the process to be explained. How long is this going to take? What kinds of tests are you going to do? What kind of information are y'all wanting to gather? Just kind of broad. I think you want to go in kind of with an idea of what to expect, because expectations are so important. We don't want to have expectations that then aren't met. So I think just asking questions, what kinds of tests, what are we looking for, how is this going to help, stuff like that. Should my ABA provider be able to use the results from our assessment to develop our ABA programs? Absolutely. That the information that is provided from a good assessment is so important. So the ADOS specifically will tell you about eye contact, social approach, like can the child approach socially, gestures, are they using gestures to communicate? Are they using communication effectively? Are they imitating? Do they use imagination and creativity? Like so many aspects that are so important for social development and verbal development. That will provide information on all of those things. An assessment with cognitive and IQ scores would tell you about the cognitive strengths and weaknesses. So for instance, so often in our autism population, kiddos on the spectrum often have a really big skill in processing visually presented information. So perceptual skills. So this would be things like puzzles. This would be making sense out of the visual environment is something that their brains tend to do really well. Making sense out of the verbal environment is usually a deficit, but we would want to know, does this kid have a big skill in a certain area? How can we play this skill to his strength? Just for instance, very broadly, if you have a kid who's very visual and is understanding visual information really well, but hasn't yet developed language, using a visual schedule is so helpful and so important. They're not going to understand what you're saying if you're saying, first we're going to do this, and then we're going to do this, and then we're going to do that. That's just going to sound like a bunch of mumbo jumbo to them, or they might not even be paying attention to you. But a visual schedule with pictures, they may totally get that and then be able to predict what's going to happen next. Being able to predict what's going to happen next lowers anxiety. There's just so many things. So absolutely, the results from an assessment should help with specific behavior goals, skills goals, strengths and weaknesses, things to focus on, things to build up. Yes, hopefully that answered that question. What if a child refuses to participate in the cognitive test, but at home shows a high level of intelligence? This has been known to happen. I mean, especially if you're talking about school psychologist. In general, you know, it's kind of my job to make the kid feel, you know, comfortable and build rapport. However, I will say that these cognitive tests were developed for the neurotypical population. So they aren't really developed to speak to a kid on the spectrum strength, if that makes sense. So a lot of the times these tests are a struggle for kiddos on the spectrum because all the information is presented verbally. A lot of the times we'll use a nonverbal test of intelligence, and that seems to go over better because there's no language requirement. So we'll do that. And this, if you're talking about a school, the school should be able to do this as well. So we'll do a nonverbal test, which, you know, is a lot easier for a kiddo on the spectrum because they just can point to pictures or look at pictures and point to the right answer, and they don't have to produce speech. So that's what we would probably do. Trying again later sometimes helps. Sometimes we have to modify kind of the administration of these tests to help the kiddo, taking frequent breaks, rewarding finishing a subtest, dividing the test into two halves. Like we like to do it all at once, and that's how it was standardized, is doing it all at once. But you know, if you really want IQ scores and your child's having a hard time, we could divide it into two days. Not ideal, but definitely, you know, better than nothing, I'd say. And then just trying again later too. I think, you know, as kids get older, it can be easier to test them. But I would definitely probably try a nonverbal test to see if you can get a good score, a good reliable score. And then if that didn't work, try these other things. Let's see, 2 minutes. Let's see if I can answer a couple more of these. Oh, I did get this one a couple times of like, when should you get autism, or how young can you be? So we start testing, because we're a specialty center, we start testing really young, 12 months. I had the ADOS starts at 12 months. So I would say it's harder to diagnose at 12 months, but definitely if you're someone who's thinking the symptoms are there and your child is over 12 months, an autism specialty clinic should be able to do a diagnosis. Pediatric neurologists and primary care physicians and pediatricians will probably not diagnose that young. In fact, sometimes they're waiting until like 4, 5, 6 to diagnose, which, you know, is a problem if you're talking about trying to get interventions for your kid. But if you're going to an autism specialty clinic, they should be able to diagnose. We often diagnose 18-month-olds here. It's super fun because the ADOS at 18 months is just, it's play-based. So yeah, I would say go to a specialty clinic if you're thinking about getting someone younger than 3 diagnosed. And unless you can find someone out in the community who does it. But yeah, we start, I would say 12 months, the ADOS is reliable. So let's see. Oh, it's one. Okay. Thank y'all so much for your questions. These questions were really, really good. I really enjoyed reading them. So I'm doing another Q&A on July 11th, like I said, about therapy. So if y'all have questions about therapy, feel free to send them. If y'all have additional questions or things y'all want me to cover in the future, don't hesitate to ask. But this has been so much fun, and I think you will be getting a survey in a little bit if you signed up for this webinar. With some questions to answer. But anyways, thank you for sticking around with me for the hour. Hopefully y'all learned something. I know I had a good time, and I'll see y'all next time.